Having the right nursing workforce ensures that we have a high quality, safe service for patients. And nurses work right across our services, in the community, within the hospital, with the young, with the old, and making sure that we have a workforce that has the right skill set, in the right numbers, deployed and at the right time, is essential for patient care.
There's an international shortage of nurses, so we have challenges about getting the right numbers, but crucially how those nurses work. So today I'm enhancing how we're going to take forward the Nurse Staffing Act and the measures we're taking to do that, developing evidence-based workforce tools so we have a sound basis on which to move forward, and of course not just that mix of staff and the numbers, but how they work with other healthcare professionals, and obviously key messages around pay and planning as well.
This is a pioneering piece of work. It's groundbreaking. It will make a difference to ensuring that we have tools and techniques that really help us understand what are the workforce requirements, what are the skill mix requirements in each of our clinical areas. It means that we can workforce plan more accurately. It means that we can allow for better multidisciplinary working when we understand what our patients' needs are.
Day to day it'll mean that the staffing levels are what they should be to look after these patients, to give them the time that they need and to look after these patients with dignity and respect, and to make sure as well it's important it affects the staff on the ward, the staff morale is kept well because they know there's enough staff there on duty to look after these patients, to give them the care that we need to give them.
This law is unique. No other law in the world actually describes a methodology that says you must look to see what is happening to your patients and match the number and skill set of your staff to their need.
It will help us ensure that we are using our resources prudently, both nursing resources and our financial resources. Most importantly, it will help the public understand how we allocate nursing staffs to work with them to care for our patients and keep them safe.
Nurse staffing for me is the right staff with the right skills in the right place, ensuring that we've got quality care for our patients.
Yeah, for nurse staffing, it's not just having the numbers of staff on the ward, it's having the right staff who are trained appropriately to provide the best care for the patients that we've got.
If you've got the right staffing level, you can feel good about the job you do, you don't have to rush, and that will improve your confidence and your ability to perform.
For patients, it means being in receipt of good quality care. For their relatives and their family members, it means that they can be confident in the care that their loved one is receiving. And for nurses, it's about joy and pride in being able to deliver the care and enjoying coming to work.
I think it's working with my ward managers to make sure that we're inputting the data correctly and trying to interpret what those visualisers are telling us, really.
The main thing is that we need to invest in making sure that the collection of this information is as simple as possible, so that staff can use this not just on a twice-a-year basis, but can embed this into the way that they monitor their staffing levels on a daily shift-by-shift basis.
I think some of the challenges will be recruitment is one of the biggest ones, making sure that there's enough staff to fill the posts that are out there. And it's looking at recruitment and what the needs of the workforce are these days, because the workforce has changed such a lot. The needs with family restraints, we need to be more flexible. We're looking at how we recruit our staff.
The Train Work Live campaign for nurses has had a high level of recognition, so lots of nurses within Wales but further afield as well. So we've had lots and lots of interest in our Facebook and social media pages, and we're seeing NHS trusts and health boards here in Wales looking to recruit as well. So there's real interest right across the UK and further afield as well, and we're particularly pleased with some of the international campaign response as well.
There's always going to be challenges, I think, to set this up. People hold dear to what they know. This is new. It's going to be hard work to get to push through and get people involved in. But as soon as they see the benefits they can have, I'm sure it'll be easy.